begin. Welcome, everybody. And yeah, it's really cool to see people from all over and some familiar faces and some that I look forward to getting to know. So thank you, Emil, so much. And thank you, Sharon, for the opportunity to give this talk. So let's begin. I have a fair amount of material to cover. I'm not sure I'll be able to do it in an hour, but we'll see how it goes. We might go over a little bit. So if you have questions, please interrupt. You can unmute yourself and ask a question. I'll also leave time at the end for questions. I think there are a couple times I might ask you to do stuff in the chat, but I won't have that open the entire time. So maybe some of you would be able to answer questions for other people also in the chat. Okay, so tricks for treating constipation. So the reason I wanted to do this lecture today was because it was only when I started studying the classics and with a few different teachers that I understood that shao and baijiu in large dosages could be used for constipation. Also, I think whenever I decided to do this talk, I think it was quite a while ago, last fall or something, I had quite a few patients with constipation. So I thought, okay, this would be a really good thing to do. When I started to work on the class, though, I realized that there were certain aspects beyond just talking about shao and baijiu that I wanted to discuss. So I think in clinic, what has tended to happen for me is that constipation is a secondary complaint, and it's not what people are coming in for as a primary complaint, though occasionally, of course, that happens. So how do you think about dealing with constipation as a secondary complaint? How do you modify your formulas? How does it change your diagnosis even? So I think it can be really helpful, actually, and really useful because it gives you a lot of information about the person. I'm going to discuss a lot of different formulas today and modifications of formulas. I think all the formulas are going to include shao or baijiu. And I also realized that constipation can occur in any of the conformations. If you're thinking about the circle and the sweeping motions through the circle, you need to consider all of them when you're looking at constipation. Of course, we think of Yang Ming immediately, but many cases of constipation are not Yang Ming issues or not Yang Ming issues by themselves. So this is what I wanted to try to cover today. So in TCM school, we learn all these different patterns for constipation, and they're somewhat useful, especially with constipation. These patterns vary drastically from book to book. This was a kind of general list that I got from various books. And when I started in clinic many moons ago, I just didn't find this helpful. I found it very difficult to figure out with most cases, I found it very difficult to figure out which pattern made the most sense. And then often it was complicated because there was lots of other things going on. So I just didn't find this useful at all. Uh, and then there's some common formulas that can be very, very useful if they match the pattern, but it still didn't cover all the patients that you're going to see. For deficiency, Maizurenwan is really useful. For excess, the family of Chengqitang formulas when there is when Yangming is primary. Then there's some deficiency formulas like Runchengwan and Zhengyertang. Runchengwan when there's both blood and yin deficiency, Zhengyertang for fluids. Kara Frank gave a great talk on Zhengyertang, and that one is like a small formula that can be added to other formulas for sure. And then food stagnation, Baoherwan. So these are all useful, but it doesn't cover everything that you find that you see clinically. Also, I just wanted to note that there is a bit of research on pattern-based associations for constipation using herbal medicine. So that's a quick citation there. So your patient comes in with some issue and they happen to mention that they go to the bathroom once a week or every few days. For them, that's so normal because it's been going on for so long, they hardly even think of it as an issue. This happens so frequently in clinic. Sometimes it might be getting worse or not, so they mention it. Sometimes you have to really dig deep to find out. Or just maybe it's not digging deep, you just have to question your patients carefully to find out that this is an issue for them. One of the ways that I do that is I ask patients, if they say their bowel movements are fine, I'll ask them, well, do you have a tendency towards constipation or loose stool? Just to kind of nudge them towards giving me more information. So the formulas we're talking about today are, or one of the ways I think about it is this is a way to use formulas for patients with constipation as a secondary complaint. But that fact that it exists in your intake informs your diagnosis, and it can also inform how you're modifying your formulas. So without thinking about the 6 conformations, and kind of how I think about constipation in terms of the 8 parameters, I came up with this chart because you can have constipation due to heat for sure, but you could also have it due to colds, freezing everything, stagnating everything. There can be excess or deficiency. The excess is that stagnant stool. The deficiency could be either the lack of ability to move in the intestinal tract or a lack of fluids. So we're talking about qi stagnation here or qi deficiency. It could be blood stagnation or blood deficiency. And we're talking about body fluids. It could be excess. There could be damp that's stagnating the intestines, or of course, deficiency, which is drying up the intestines. So I think if you think about all these parameters, it's so helpful when your patient comes in and presents. You get all this information from putting together what they're presenting with. So you can just say, oh, they're constipated. So I need to say, is it hot or cold? Is it deficient or excess? what's going on with the qi, the blood, the body fluids. Of course, you do this with any diagnosis, but the constipation kind of clarifies it a little bit in my mind. And hopefully, after the lecture today, more so in yours. So, when we look at constipation through the space time continuum of the 6 conformations, so we're looking at the circle when we're facing south. And so the directionality is clockwise. And the constipation could be appearing in the yang conformations. It tends to be more excess. It tends to be more stagnation that you're looking at. For sure in Yang Ming, where that's the excess of yang when you have a Yang Ming pathology. In Shaoyang, where the pivot is closed and so there's excess heat, again, excess, the yang is stuck, it's not flowing well because the pivot is closed. And even in Taiyang, where you can't, there's maybe too much wind and cold and damp for the Taiyang to be able to flow up and out well. In the yin conformations, it tends to be a deficient issue, though. So Shao Yin, there's deficiency cold, and Tai Yin, there might be deficient or excess fluid. So Tai Yin is sort of the exception there. In Shui Yin, we're looking at blood deficient constipation where the things are dried up.